This is an introductory video about rubber dam clamps. Understanding the different clamps is crucial for successful rubber dam installation. Choosing the right clamp is essential and can often distinguish a dentist who excels at using the rubber dam from one who struggles with it. In this video, I will provide a clear understanding of the various parts of a clamp, as well as the different types of clamps available. Stay tuned for multiple practical follow-up videos that will build on this introduction and enhance your skills. Rubber dam clamps consist of several parts as shown in this picture. Each clamp features a bow, two beaks, and two holes through which the forceps can manipulate them. Some clamps also have wings. These wings allow the clamp and rubber dam to be placed together more efficiently. Rubber dam clamps are selected based on the cervical anatomy of the tooth. The smaller the tooth, the closer the contact points need to be. Clamps are classified based on various criteria. The first classification is whether they are main retentive clamps or retractive clamps. A main or retentive clamp is typically placed on the last tooth to secure the integrity of the rubber dam during the procedure. In contrast, retractive clamps are used to retract the rubber dam in specific areas, such as during Class 5 restorations or crown veneer cementations. These clamps are generally more flexible, but cannot maintain the rubber dam's integrity on their own. The next criteria for classifying clamps is the material from which they are made. Clamps are categorized into metal clamps and resin clamps. Metal clamps are commonly used for most procedures. However, resin or soft clamps are preferred in situations where there is a risk of trauma to the tooth, such as when a tooth has a crown or when there is hypocalcified enamel present. Another classification of clamps is based on whether they are winged or wingless. Winged clamps are primarily used when the rubber dam and clamp need to be placed together on the tooth. This method has its own advantages and disadvantages, which we will discuss in future videos. On the other hand, wingless clamps are better suited for restorative procedures because they are smaller and do not interfere with matrix placement. Since they lack wings, they are typically used with the clamp-first technique. There are various shapes, sizes, forms, and brands of clamps available on the market. It's not necessary for a dentist to own every type to manage all situations. In fact, most dentists typically rely on a limited number of clamps tailored to their specific practice needs. In the upcoming videos, I will guide you on how to create your own set of clamps based on the procedures you routinely perform in your office. Additionally, I will demonstrate how to secure a clamp with dental floss before placement and test if a clamp is suitable for a specific tooth. I'll guide you through selecting your own set of clamps, helping you avoid unnecessary expenses on ineffective options. You'll learn tips for choosing the right clamp for restorative procedures on specific teeth. I will also discuss when and why to use resin clamps. Finally, I will cover how to handle extremely complicated conditions that require special clamp selections in the upcoming videos. It's important to note that selecting and applying the correct clamp requires experience. In this course, I will share my expertise as comprehensively as possible, so you can become comfortable using the rubber dam quickly and efficiently.